In this video, we're going to talk about something that's not often mentioned in doctors' offices, but it affects a lot of older adults, especially those over 70. Many of you go for regular health checkups, thinking you're doing the right thing, and for the most part, you are. But there's something important you need to know. Not every test is as helpful as it seems. In fact, some can lead to problems you never expected. If you're someone who's always followed your doctor's advice, this might feel confusing at first. But our goal today isn't to scare you or tell you to stop seeing your doctor. It's to help you make smart, informed decisions. Because once you understand how some of these tests can affect your body, your mind, and your daily life, you'll be in a better position to ask the right questions, weigh the risks, and protect your health in a better way. Before we begin, I'd love to hear from you in the comments. Where are you watching from? How old are you? And have you ever gone through a test or treatment that you later regretted or felt was too much? Test 1. Bone density scan, DEXA scan. Let's begin with a test that sounds perfectly safe, the bone density scan. Also called a DEXA scan, this test is often given to older adults, especially women, to check for bone loss or osteoporosis. It's quick, painless, and doesn't involve any needles or fasting. So on the surface, it feels like a smart thing to do. But here's the part most people aren't told. After age 70, bone density naturally goes down for everyone. It's just part of aging, like gray hair or wrinkles. The problem is, these scans often label this natural change as something risky, even when it's not. Many older adults are told they have osteopenia, which sounds scary but just means slight bone thinning. The next step? Medications. And this is where the real trouble begins. Drugs like alendronate and other bisphosphonates are commonly prescribed to improve bone strength. But these medicines come with serious risks. Some people experience severe acid reflux, stomach pain, or inflammation of the esophagus. Others face rare but dangerous side effects like jawbone death. Yes, actual bone tissue breaking down in the jaw. And despite these risks, the benefits for people over 70 are shockingly small. A large study followed women over 70 who took these medications. After 5 years, the reduction in fracture risk was just 0.3%. That's not zero, but it's a very small gain when you compare it to the possible harm. And what's worse, being labeled with a bone problem often causes anxiety and fear, even when there's no real danger. Here's a better approach. If you haven't had a fall, fracture, or serious bone injury, focus on strengthening your body naturally. That means gentle resistance exercises, using resistance bands or light weights. It means eating calcium-rich foods like leafy greens, dairy, or sardines. And don't forget about vitamin D. Getting a little sun or taking a supplement can really help. Test 2, brain MRI for mild memory loss. Now let's talk about something that feels a lot more emotional, memory loss. As we get older, it's normal to forget a name here and there or misplace our glasses once in a while. But for many seniors, even small memory slips can spark fear. Am I getting dementia? Is this Alzheimer's? Those questions can be scary. And that's why many doctors recommend a brain MRI. An MRI sounds like a smart move. It gives a detailed picture of your brain and can show changes that aren't visible otherwise. But here's what most people don't realize. For adults over 70, these scans often show normal age-related changes, things like tiny spots or slight shrinkage that are expected and harmless. But when patients see these results, they panic. You see, once those abnormalities are spotted, it often leads to more tests, sometimes spinal taps, sometimes even brain biopsies, all because of something that wasn't a problem in the first place. In fact, a 2021 study looked at over 3,000 seniors who had mild memory complaints and got brain MRIs. Nearly 86% of them showed something on the scan, but only 3% had anything that was treatable. That means most people walked away with fear, not help. Let me share George's story. He's a 74-year-old retired engineer, smart man. He started forgetting names and felt worried, so he had an MRI. It showed white matter changes, which are common with age. His doctor mentioned dementia, and that changed everything. George stopped driving. He stopped going to church. His anxiety got worse, not better. Later, when we tested his memory with a simple paper-based exam, it was totally normal. We helped him work on sleep, hydration, and daily brain activities like puzzles and reading. 3 months later, he felt like himself again. So here's the point. If you or a loved one is experiencing mild memory lapses, but no serious symptoms like seizures, sudden personality changes, or rapid decline, start with a simple cognitive screening test. It's quick, safe, and far less stressful than jumping straight to an MRI. Test 3. Cardiac stress. Let's move on to something many of you have probably gone through, or at least been told to consider, the cardiac stress test. It usually happens when you mention things like mild chest tightness, feeling tired, or just not having the energy you used to. Your doctor might suggest walking on a treadmill while your heart is monitored, or they might give you medicine that simulates exercise. The goal is to see if your heart is getting enough blood. Sounds helpful, right? But here's the problem, especially for people over 70. These tests can often give false positives. That means the test shows something is wrong, when really, your heart is just fine. And that false result can open the door to procedures you never needed in the first place. In fact, research shows that up to 40% of seniors who take this test end up with false alarms. That leads to things like angiograms, stents, or even bypass surgery. But here's the real shocker. A major study found that over half the stents placed after stress test referrals had no clear benefit. The patients weren't feeling better. They weren't living longer, but they were dealing with complications like bleeding, kidney issues from contrast dye, or long hospital stays. Raymond, a 75-year-old retired postman, was one of them. He mentioned feeling a little more tired walking up hills. His doctor ordered a stress test. The results were unclear, so he had a heart catheterization. They found a slight blockage and placed a stent. That night, the contrast dye triggered a reaction that damaged his kidneys. He ended up in the hospital for 6 days. The fatigue never went away, because the real problem wasn't his heart. He just needed more hydration and shorter walking intervals between meals. Here's what you should know. If you're not having classic heart symptoms like chest pain during activity, shortness of breath on exertion, or a big drop in energy doing simple things, then a stress test might do more harm than good. Instead, consider safer options like a resting EKG or a coronary calcium scan. Both are easier, lower risk, and can still give useful information without dragging you into unnecessary treatment. Point 4. Colonoscopy. After 70. Now let's talk about a test that many of you have been told is essential for cancer prevention. The colonoscopy. This is the procedure where a long, flexible camera is used to check for polyps or early signs of colon cancer. For younger adults and those at higher risk, it can be life-saving. But for people over 70, especially those over 75, the picture changes, and not in the way most clinics will tell you. As we age, our bodies become more sensitive to certain types of procedures. A colonoscopy isn't just a quick test. It requires intense preparation, including powerful laxatives that flush your system completely. For seniors, that process can cause dehydration, dizziness, and even kidney problems. Then there's the sedation during the test, which might increase the risk of confusion, memory issues, or heart rhythm changes in older adults. And the benefit? A major study that followed over 1.3 million Medicare patients found that for every 1,000 colonoscopies done on people aged 75 and older, only 2 lives were saved, while more than 20 people experienced serious complications like bleeding, bowel tears, or extended hospital stays. That's a risk-to-benefit ratio of 10 to 1 against the test. Let's take the story of Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She was active, had no symptoms, no family history of colon cancer, and had already done 2 clean colonoscopies in the past. But her new doctor, fresh out of residency, pushed her to do another one just to be safe. During the procedure, a small polyp was removed. That night, Dana collapsed. She had suffered a bowel perforation. She was hospitalized for 9 days, lost 10 pounds, and never fully got back to the energy level she once had. The U.S. Preventive Services Task Force now recommends stopping routine colonoscopies at age 75, unless there are clear symptoms like bleeding or major changes in bowel habits. Instead, many seniors can use a FIT test, a simple at-home stool test that doesn't require any prep or sedation, but still catches most problems effectively. Test 5. Full-body CT scan. Let's wrap this up with the most commonly misunderstood test on the list, the full-body CT scan. You've probably seen it advertised as part of executive checkups or private clinic health packages. They say it helps catch cancer early or give peace of mind. It sounds like a good idea, especially if you're trying to stay one step ahead. But for people over 70, this test might do the exact opposite. A full-body CT scan exposes your entire body to high doses of radiation, about 10 to 20 millisieverts in one scan. That's the same as getting around 500 chest x-rays in one go. And according to a 2023 study published in JAMA Internal Medicine, the growing use of CT scans in the US could account for up to 5% of all cancer cases. That's the same level of risk as daily alcohol consumption. Imagine that. 1 out of every 20 cancers might actually come from the scan meant to prevent it. And what do these scans usually find? Small spots, tiny nodules, harmless calcifications, things that happen naturally with aging. But once they show up on the screen, the system kicks in. You get sent for more scans, more specialist visits, maybe even a biopsy, and suddenly you're stuck in a whirlwind of fear and procedures, all for something that may have never caused a single symptom. Take Marcus, an 80-year-old martial arts instructor for seniors. He was healthy, active, and felt great. He went in for a private full-body scan. They found a 3 mm lung nodule, nothing unusual for his age, but that led to a PET scan, then a biopsy. The biopsy caused his lung to collapse. He ended up in the hospital and spent 2 months recovering. In the end, the nodule was benign. This is why major health organizations, including the American College of Radiology, now say clearly, do not use full-body CT scans for routine screening in people with no symptoms. If you have specific issues like weight loss, coughing blood, or swelling, yes, a focused scan makes sense. But scanning everything just in case? That can do more harm than good. Your body isn't a mystery to fear, it's a story to respect. Trust how you feel and choose tests that make sense for you, not just because they're offered in a package. So here we are, 5 common checkups that might seem helpful on the surface, but can actually do more harm than good if you're over 70. It's not about rejecting medical care. It's about asking the right questions, understanding the real risks, and avoiding fear-based decisions. Modern medicine has done amazing things. It's helped many of us live longer, recover faster, and manage serious conditions. But it also has a tendency to overtest, overtreat, and overworry, especially when it comes to seniors. Not every test leads to better health. Sometimes it leads to unnecessary medications, painful procedures, or months of anxiety that didn't need to happen. Here's what we want you to remember. Prevention isn't just about tests. It's about living wisely. Eat well, stay active in a way that feels right for your body, prioritize sleep. Keep your mind engaged, read, play games, talk with friends, take walks. And if something doesn't feel right, that's when it's time to talk to your doctor. But if you're feeling fine, don't let a test chase you into problems you didn't have. Before you say yes to any medical scan, ask your doctor one simple question. If this test finds something, what happens next? If the answer feels vague, or sounds like, we'll just monitor it for now, that might be a sign that the test isn't necessary. Your time, your energy, your comfort, they matter. You deserve peace of mind, not fear of the unknown. Every person is different. Some may still benefit from these tests if they have symptoms or strong family histories. But for most healthy seniors, the smarter path is to focus on how you live day to day, not how many tests you've done. Now, we'd love to hear from you. Have you ever had a test that turned out to be unnecessary or caused more stress than help? Did you or someone you know go through a procedure that you later questioned? Share your experience in the comments below. Your story might help someone else make a more informed decision. And if you found this video helpful, please give it a thumbs up, share it with someone you care about, and subscribe for more thoughtful health content made just for you. Because at this stage of life, your choices should bring you peace, not pressure.